Hello and welcome to University of Missouri Healthcare's Department of Emergency Medicine. There are a few things we'd like to share with you while we get your treatment started. While you're here, you will receive care from a team of experts, including nurses, resident physicians, physician assistants, and supervising physicians. You'll meet with them soon. Right now, we'd like to explain how each of these caregivers will work together to help you feel comfortable with your emergency care.
The first people you'll meet are the triage team nurses. It's their job to ensure you are promptly given an initial exam. They'll also ask you a few questions about your medical history and measure your heart rate, your blood pressure, and your temperature. If your condition requires additional testing, they may get that started now. Wait times in the ER may differ due to severity of other patients' conditions and resources available. While this might mean a wait for you, rest assured that we are working hard to get your care started as soon as possible. After you are shown to your room, you will meet the other healthcare team members who will take care of you during your stay. They'll ask you questions about your symptoms, medical history, pain level, and perform a more detailed exam. After speaking with you and giving you an exam, you may also need to have blood drawn or an IV placed. If at any time you need assistance from the staff, please use your call light.
You may be evaluated by a resident, fellow, or other trainees during your stay. Resident physicians are physicians training to become a specialist in emergency medicine or another related specialty. These are not medical students. Each resident physician is licensed to provide your care and is directly supervised by an attending physician. The resident physician will ask you detailed questions about your illness or injury, questions about your past medical history, and perform a physical examination. The resident and the attending physician will discuss your condition, develop a plan of care for you. The resident physician will check in with you during your time in the emergency department.
Physician assistants and nurse practitioners are trained, licensed medical care providers who work under the supervision of an attending physician. They can provide you many of the same types of treatments that a doctor would. Depending on the severity of your condition, you may see the PA or NP during your stay instead of a physician. Supervising physicians are always available if you wish to speak to them.
An attending physician is always responsible for overseeing your emergency department care. All of our attending physicians have completed training specifically for the care of emergency medicine patients and are board certified. You'll likely be asked to answer some of the same questions about your illness or injury by the attending physician, and you might need another physical exam. This is to ensure you get the best possible care from our team. Other valuable emergency department team members you may see include patient care technicians, patient advocates, care coordinators, radiology staff, specialty physician consultants, clinical pharmacists, medication history technicians, and our wonderful volunteers. We all work together as a team to help make your time here as positive as possible.
As part of your emergency care, you may need tests to help us diagnose and care for you.
You may need to have tests which require imaging like x-rays, CTs, or ultrasounds. These tests may take place in your room, in another room in the ED, or in a nearby department like radiology. Sometimes the test results will be available quickly, but others may take longer because they are more complicated and may require additional specialists' evaluation. In all cases, we'll do everything we can to make sure you get your results as quickly as possible. We may need to run laboratory blood tests as part of your care. Some test results are completed quite quickly, like strep throat or flu swabs, while other specialized tests may not be back for several hours. If your illness or injury is severe or complicated, you may need a consultation with a specialist who is called to come see you in the emergency department to make sure you get the most thorough care available. The time required for these consultations can vary from 1 to 4 hours.
Many times, we are able to provide care for you, allowing you to go home. However, sometimes we will advise that you be admitted to the hospital for further care. If you are admitted to the hospital, you'll likely need to speak to a medication history technician. Although you may have already told others about your medications, it's their job to make sure your home medication list in our system is accurate so that we can ensure you get all of the medications you need during your hospital stay. Our technicians work under the supervision of our pharmacists. If at any time you have questions about your medicine or wish to speak to a pharmacist, please don't hesitate to ask.
We hope this video has helped you understand your emergency department care. Thank you for watching this video as we work hard to get you feeling better. Please don't hesitate to ask any questions you may have, and thank you for entrusting MU Healthcare Department of Emergency Medicine to provide your care.